No outer membrane, so it is most closely related to gram-positive bacteria. Remember that bacteria need to protect their contents with multiple layered envelope.
Next, in the third step, that fructose 6-phosphate that was generated by the isomerase reaction has another phosphate group added onto it, again the terminal phosphate in ATP, generating fructose 1,6-bisphosphate.
This one is the posterior one, and then this one here is the anterior one. The posterior is the one that we have already seen, and it is the artery that accompanies the axillary nerve as the two exit from the quadrangular space.
Let's now look at the axilla and its important contents using our 3D model.
In this scenario, a retrospective cohort study would be more efficient. You could certainly do a prospective, but a retrospective would be something that you would want to consider, and that's exactly what was done.
Let's say you're in your office having a sunshiny day when you notice the husband of the person you were seeing, who's also your patient, not responding to his wife and reaching for a chair. You and his wife help him to the ground. Afterward, you notice that he is on the ground, he appears unconscious, and he had a few jerky movements of his arms and legs, but now he's lying still.
Practicing a healthful behavior oneself is the most consistent and powerful predictor of physicians counseling their patients about this same behavior. Physicians who engage in regular physical activity, who manage to quit smoking, who use seatbelts and sunscreen, are more likely to counsel their patients